Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss the acceleration of the privatisation of the NHS and the major news this week that a private healthcare provider, only recently taken on by the government to provide cancer care, has collapsed, taking our tax money with them, and meaning that a lot of cancer patients are going to be without treatment for longer as well. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So at the simplest level, what's happened is that the government have been privatising our healthcare for years. Instead of funding the NHS as they promised on the Brexit bus, they've been giving money to private providers instead. When Boris Johnson insists that he has given the NHS the £350 million a week that he promised and more besides, that's what he was saying last week, it will come as no surprise to hear that he is lying. In fact, the NHS is getting less money, not just less money in real terms, less money, because an increasing amount of healthcare spending is not going to the NHS, but private providers. Sometimes, to confuse the figures, the government forced the NHS to funnel the money through their books before passing it on to the private providers to make it more difficult for analysts to try and work out what money the NHS are getting and what is just going on private healthcare. But at the end of the day, in the UK, we have the NHS and we have private healthcare companies. If the money is to be spent on private healthcare, it's not been spent on the NHS, no matter what the government does or says. And even when the private care being paid for is provided, it's relatively poor value for money. Stands to reason. A private healthcare company needs to make a profit, and a large one if the CEO intends to keep their job. So they spend as little as they can get away with on the actual care. But hang on a minute here, Phil. It can't be that bad, because if private healthcare was that bad, we'd be seeing record waiting times for treatment and... Oh, wait, carry on. But this is for relatively decent care providers. You know, there are private providers who will provide a good service. You just pay through the nose for it. If we just gave that money to the NHS, we'd get the same good service, but the shareholders are us, because the money goes back to the UK Treasury. That's us. So the profit, so to speak, is back in the public purse to be used for research and development, expansion of services, or tax cuts if things are going really well. But this latest news didn't concern a good healthcare provider. There were a number of red flags reported about this particular business. First of all, the company, Rutherford Health, had what's described as a complex financial structure. Now, this is always a warning. Like, bear in mind, there are a lot of companies set up as subsidiaries of others, specifically to get as much money as they can and then let it collapse. Like, if a person owns a company, have a normal company, that person owns a company, or a group of shareholders owns a company, and then that's it. Of course, they want to make sure that their company survives. Of course they do, because that's their source of wealth. But if you have a complex portfolio of businesses with several subsidiaries that are not real companies at all, they just exist to funnel the money, they're just there on the books, there's little to stop you running an unsustainable business plan to extract as much money as you can, prop it up with loans from your real businesses, then you let that subsidiary go into administration with the money hived off elsewhere. It was also noted that the company had fired 4 directors earlier this year and moved their accounting period. This would also tell anyone paying attention that something was up with this company. Then you look at this balance sheet summary. How does a company have just over £7 million in revenue but over £30 million in administrative costs? How is that? And then this summary shows them reporting at a loss of about £30 million. It's like, yeah, that's their administrative costs. How? What? It's a classic case of getting one company to pay another company for various services, run up debts that then disappear into the ether when your sacrificial company has to go into administration. And of course, business practices like this shouldn't be legal. There's no need for it. It's not an inherent part of the system. You know, you don't have to permit it. It's permitted because governments either don't feel they have the time to tackle it for fear of distracting from other important issues, because it could take a hell of a long time, or because they don't want to. Because, for example, those companies make sure to offer kickbacks to the party in government in order to not only keep giving them the contracts, but not pursuing them when they take the money and run, which is what's happened here. On an unrelated matter, Rishi Sunak still isn't chasing up those billions of pounds worth of furlough fraud, or even the billions of pounds spent on PPE that we didn't get. In a recent article in Central Bylines, it pointed out that the government seemed happy to chase benefit fraud, which is fine, but not business support fraud. Now, what would be the justification for that? Because business support fraud amounts to more public money lost, a lot more, than benefit fraud. Not that it should be a choice. The government can pursue both. If there's fraud of public money, why not pursue both types, all types? But why pursue one type of fraud and not another? And if you're going to pursue just one kind, why pursue the kind that robs the public of the least money? Why wouldn't you go for the one that's draining the most public money away? There are myriad examples demonstrating that the Conservatives work for the interests of the wealthy, not the people. Strategically, the reason's clear. They need the people for votes, but they need the wealthy for their money. But the people keep voting Tory, even as they make their lives worse. So those votes are often taken for granted. Maybe throw them a bone at election time and they'll be fine. You know, the bone they're planning to throw for the next election is a 1p tax cut as we build up to that election. Want to know what that's worth? 1p tax cut. If you earn the median average in the UK, that would save you £191.93 a year. Not exactly going to help you with the extra cost of food, fuel and energy thanks to Tory profiteering, is it? But it works precisely because very few voters bother to actually work out the costs and benefits of the government they've just had in power. But they cannot take donations for granted because their donors expect a return. They do follow the balance sheet. They know what they're getting for their donation. And they will only splash the cash if they get that return. Remember, in the final days of Theresa May, Tory donors abandoned the party, only coming back once she'd resigned. They know how to flex their muscles. And they do it regularly. So even without taking ideology into account, a Tory government will never chase cheating of the public purse because it would uncover their financial lifeline. So we're stuck with this. The government keep giving out private contracts for services that would be better through state-owned organisations, knowing full well that in all cases it means a poorer service for the money. And they also know that every now and then some of these companies will take the money and run, safe in the knowledge that they will not be pursued. This is Tory economics. So I get particularly upset when I hear people who should know better thinking that the Conservatives are either good with the economy or trustworthy guardians of our public services. What was it John Major said of certain Tories and the NHS? Quote, I seem to remember Michael Gove wanting to privatise it, Boris wanting to charge people for using it, and Ian Duncan Smith wanted a social insurance system. The NHS is about as safe with them as a pet hamster would be with a hungry python. And finally, it's worth considering the human cost to all this. You know, this private company was supposed to be delivering cancer services. It's gone bust, so it won't be fulfilling that contract. It's taken the money's gone. No service. That's people with cancer who will have to wait much longer for treatment. Now, no ailment really benefits from having to wait longer for treatment, but cancer very famously needs swift attention to get good results. I suspect this is why Starmer brought it up a bit in yesterday's PMQs. You know, this political decision will mean the deaths of people. It will mean children losing a parent or others losing a partner. And in actual fact, children's cancer services are privatised now as well. So I don't know whether this particular company was going to be involved with that, but it could also mean some parents losing their children earlier than should have been the case. I mean, no parent wants to bury their child. But all of the people who are going to suffer from this may then find themselves without a good outcome. And this wasn't an unforeseeable outcome either. Like I say, the minister's responsible. They don't get to say it's unintended, because not only does this sort of thing happen often enough for it to be foreseeable, but as people have pointed out, there were specific warning signs with this company before the contract was issued, but the government ignored them. Not because they didn't recognise the signs, but because they didn't care. They didn't care about the public money being wasted during a cost of living squeeze. They certainly didn't care about the lives put at risk because of their greed. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. If you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.